Raw milk outbreak in Florida. Health alert on Campylobacter E. coli infections. Imagine this. A group of people in Florida fell ill after drinking milk straight from the udder, without any processing to make it safe. This isn't just a story about a few bad eggs. It's a stark reminder of why many health experts advocate for pasteurization. But here's where it gets controversial. Some consumers swear by the supposed health benefits of raw milk. Let's dive into what happened and why this issue is far from black and white. The Florida Department of Health recently issued a bulletin warning about an outbreak of infections linked to raw milk consumption. They reported that 21 people, including 6 children under the age of 10, had fallen ill with Campylobacter and E. coli after drinking unpasteurized milk from the same farm. 7 of those patients required hospitalization, and severe complications were reported in at least 2 cases. Now here's a twist. While it's illegal to sell raw milk for human consumption in Florida due to the risk of foodborne illnesses, there are no state laws against drinking it. In fact, raw milk can be sold legally for non-human consumption, such as pet food, because it doesn't need to adhere to the same stringent sanitary standards. The health alert emphasized the importance of informed decision-making regarding raw milk consumption. It highlighted concerns about sanitation practices on the farm in question, given the number of reported cases. So what exactly is raw milk? According to the Centers for Disease Control and Prevention, raw milk is milk that hasn't undergone pasteurization, a process that kills harmful bacteria like Campylobacter, E. coli, Listeria, and Salmonella by heating the milk to a specific temperature for a certain duration. While good farming practices can minimize contamination, they can't completely eliminate the risk of harmful germs. The U.S. Food and Drug Administration strongly supports pasteurization to ensure food safety and maintain public trust in milk as a healthy dietary staple. Despite claims about the nutritional benefits of raw milk, the FDA points out that the health risks are well documented. Since 1987, there have been 143 reported outbreaks linked to raw milk consumption, causing illnesses such as Listeria, Campylobacter, Salmonella, and E. coli infections. What about the potential risks and symptoms associated with consuming raw milk? The Florida Health Department warns that consuming raw milk contaminated with disease-causing bacteria can lead to gastrointestinal issues, including diarrhea, vomiting, and stomach cramps. In its most severe form, the STEC bacteria can cause hemolytic uremic syndrome, HUS, a serious condition characterized by hemolysis and kidney failure, particularly dangerous for children. Other high-risk groups include pregnant women, the elderly, and individuals with weakened immune systems. This situation raises important questions. Is the perceived benefit of raw milk worth the potential risk? How can we balance individual choices with public health concerns? What do you think? Share your thoughts in the comments below. Florida's raw milk warning. 21 sickened by E. coli and Campylobacter. A bold warning on raw milk. 21 Floridians fall ill, sparking health concerns. In a shocking turn of events, the Florida Department of Health has issued a stern warning against the consumption of raw, unpasteurized milk, following a recent outbreak that left 21 individuals, including 6 young children, battling E. coli and Campylobacter infections. The source? Raw milk from a single farm, which has now become the epicenter of a health crisis. 7 of the affected individuals have required hospitalization, with 2 facing severe complications that have health officials on high alert. But here's where it gets controversial. Despite the clear health risks, the raw milk movement continues to gain traction, fueled by online wellness influencers and raw food advocates. This trend has not only defied legal restrictions, but also raised public health concerns. In Florida, this legal loophole has allowed raw milk sales to soar, even as public health risks escalate. And this is the part most people miss. The Food and Drug Administration, FDA, and the Centers for Disease Control and Prevention, CDC, have long warned that raw milk can harbor life-threatening bacteria, including E. coli, Campylobacter, Listeria, and Salmonella. These pathogens can cause a range of symptoms, from mild gastrointestinal distress to severe conditions like hemolytic uremic syndrome, HUS, which can lead to kidney failure. Since 1987, over 140 outbreaks have been linked to raw milk or raw milk products, with some cases resulting in miscarriages, stillbirths, kidney failure, and even death. Pasteurization, a process of heating milk to kill harmful bacteria, is mandated by federal law for milk sold across state lines. Some states have taken additional measures to restrict or ban the sale of raw milk, but others permit it, creating a patchwork of regulations that can confuse consumers. In an interview earlier this year, Mark McAfee, the founder of one of the world's largest raw milk producers and the head of the Raw Milk Institute, defended raw milk, claiming it offers health benefits such as bioactives that boost the immune system. McAfee legally sells his raw milk in California, where state law does not prohibit its sale. However, the CDC refutes these claims, stating that pasteurized milk offers the same nutritional benefits without the risks associated with raw milk consumption. The Florida Department of Health acknowledges that many people consume raw milk without incident. However, they urge Floridians to be aware of the potential risks, which can vary depending on the source of the milk. The producer's handling of raw milk and milking procedures. As the debate over raw milk continues, it's crucial for consumers to make informed decisions about their dairy choices, considering both the potential benefits and the undeniable health risks. What are your thoughts on the raw milk debate? Do the potential health benefits outweigh the risks? Share your views in the comments below. E. coli outbreak in Florida. 6 kids sickened by raw milk. 6 young children are battling severe illnesses linked to raw milk, and this outbreak is sparking a national debate. Imagine giving your child a glass of milk, only to discover it might carry dangerous bacteria. That's the reality for families in Florida, where a raw milk-related E. coli outbreak has left 21 people sick, including 6 children under the age of 10. 2 cases have already led to severe complications, according to the Florida Department of Health. But here's where it gets controversial. While officials trace the infections to a single farm with questionable sanitation practices, raw milk advocates argue that the health benefits outweigh the risks. Could this outbreak finally settle the debate once and for all? The hidden dangers in unpasteurized milk. Raw milk, by definition, skips the pasteurization process that heats milk to destroy harmful pathogens. Experts like Dr. Keith Schneider from the University of Florida call this choice a dare, not a dietary upgrade. The idea that raw milk is healthier is absurd, he says, pointing to the well-documented risks of E. coli, Listeria, and Salmonella contamination. Yet, the trend persists, fueled by claims that raw milk preserves natural enzymes and nutrients. But here's the part most people miss. Even a single sip can be devastating for young children, whose immune systems are still developing. The CDC and FDA have long warned against raw milk consumption. But the issue remains deeply polarizing. Take Robert F. Kennedy Jr., who recently stirred headlines by praising raw milk while criticizing the FDA for aggressive suppression of its sale. Despite his high-profile role in health policy, his department has yet to alter federal regulations. Meanwhile, Florida law restricts raw milk sales to animal feed, requiring labels that explicitly state for animal consumption only. Still, loopholes in state laws allow 30 U.S. states to permit raw milk sales in some form. Chapter 1. Why kids are especially vulnerable. The E. coli strain linked to this outbreak, Campylobacter and Shiga toxin-producing E. coli, STEC, can cause more than just stomach cramps. In its worst form, it triggers hemolytic uremic syndrome, HUS, a condition that can lead to kidney failure or even death. The CDC explains that children under 5, seniors over 65, and those with weakened immune systems are at highest risk. For parents, this means watching for red flags like diarrhea lasting over 2 days, a high fever, or blood in stool. If your child shows signs of dehydration or unusual fatigue, don't wait. Seek medical help immediately, urges the CDC. A question for you: health freedom or public safety? As the raw milk debate rages on, one question lingers. Should personal dietary choices override public health warnings? While some argue for the right to choose, this outbreak serves as a stark reminder of the risks. What do you think? Does the potential for rare health benefits justify the dangers, or is raw milk a gamble too far? Share your thoughts in the comments below, and remember, when it comes to your family's health, caution might just be the best recipe.